If you buy a TV, a car, groceries, you know the cost before you check out. But in healthcare, the prices remain hidden until now.
Yeah, we've spent 2 months pricing common procedures across the metro area, and hundreds of Fox 8 viewers have helped gather information. And tonight, we begin to unveil the results of our findings. Here's part 1 of Cracking the Code, reported by Fox 8 News and Jed Lipinski of NOLA.com, the Times-Picayune.
I've got pages and pages that will shock you.
Pages of paperwork that should easily outline the cost of your care.
It's absolutely ridiculous.
But for many in the metro area, the answers remain hidden in a complex language of letters and numbers.
They charged me $2,300 to put 2 drops of deadener in my eyes.
We received dozens of voicemails, many with serious accusations.
I feel like they're ripping people off by double charging. Their billing is very suspicious.
Stories of helplessness.
I don't know if my call is going to make any difference.
And heartache.
I have a problem.
The cost of health care cripples many people in the metro area.
His bills that are just completely outrageous.
And many have a hard time understanding why those bills are so high.
Most of my family served in the military in some form.
Like Mitch Brandon, an Army vet on the North Shore.
Military's in your blood.
Yeah. This is the greatest country on earth, without a doubt. And to protect our freedoms and what we have, our way of life, it's just important.
Brandon's almost 20 years removed from his 5-year Army stint. Some recent aches forced him to make a trip to the VA.
A lot of back pain, stiffness really impacts my way of life.
The VA directed him to Wvue Regional Medical Center for 2 MRIs.
6 to 7 months later, when the billing started, I got a bill in the mail for the MRI.
How much are they charging you for the MRI?
So the $8,066.24.
How much?
$8,066.24. I was quite surprised by the amount, how large it was, yes.
The VA hasn't said it will pay the bill, but the hospital wants its money right now.
The collections department has called you.
Yes, correct.
Often the sticker shock of a bill like this is only a starting point. These prices can be negotiated down.
I think in hindsight, if it were my responsibility and we were going to pay for it, I would obviously like to know what the charges are up front before I just go and get an MRI. I had no idea it would cost that much.
Have they told you, oh, we could negotiate the rate down or anything like that?
No.
Brandon's still hopeful the VA will pick up the bill. He just hopes taxpayers won't be forced to pay that much.
My biggest concern was that knowing that this was provided by the VA or a program of the VA through the Veterans Choice Program, my biggest concern was that they would not be charging a private insurer perhaps this much. And they potentially could be taking advantage of a government program and the VA program. And it could potentially compromise other veterans, current and future veterans, from getting care.
Fox 8 News, along with our partners at NOLA.com, the Times-Picayune, and Clear Health Costs, have spent the past 2 months working to bring transparency to healthcare pricing in the metro area. We've created a database of prices.
These charges seem pretty high to me.
Right now, Wvue Regional Medical Center is asking Mitch Brandon to pay $4,000 for each MRI. But our database shows a 2-minute drive away at Medical Center Diagnostics, the same MRI costs $350 with cash. Examples like this stand out in our research. Prices for many procedures, like an MRI, can vary widely.
And it's happening more and more.
Shay Saul owns and manages Doctors Imaging. Look how close his clinic is to East Jefferson Hospital. A short drive, just a few turns. Saul says he knows of someone who went to East Jeff for an MRI. He says Blue Cross Blue Shield allows East Jeff to charge patients using insurance $825 for an MRI of the knee. For that same procedure at his clinic, the allowable Blue Cross insurance fee is about half the price, $476.
The insurance companies will typically give in for higher rates on the imaging services in order to secure lower fees for more intensive type services. Whereas when an insurance company is negotiating with a non-hospital provider for imaging services, that's the only thing they're negotiating. So they play hardball, and the insurance companies essentially tell you what the rate's going to be and you can accept it or not.
But that means facilities with the same equipment, employing radiologists with the same qualifications, could have starkly different prices.
I think price absolutely matters, and I think patients should be oriented to looking into whether or not they can get the same service at a lower cost, given it's a financial burden on them and their families.
Another Fox 8 viewer received a breast MRI at Thibodeau Regional Medical Center. The insurance company covered $1,200. The viewer and patient paid a $500 copay and an additional $1,000 for the MRI not covered by insurance. Down the road at Leonard Chabert Hospital in Homa, they tell us the cash price for the same procedure is $157. Another Thibodeau Regional Medical Center customer paid $1,500 for a brain MRI. Again, at Leonard Chabert Hospital, the same procedure cost $1,000 less. A shoulder MRI cost this viewer $748 at Ochsner and Laplace using Aetna insurance. A few miles away at Doctors Imaging, the cash price for the same procedure is $495.
The state of healthcare basically needs a total revision.
Rob Muller is a North Shore gynecologist. He showed us this recent lab bill of his annual blood work at Quest Diagnostics. It includes a nearly $850 charge for the removal of tissue.
I had no surgery. I did not have a pathology specimen. I did not have anything done other than routine blood work.
So they're saying they cut on you?
Yeah.
But they didn't?
No.
But they charge you $850 for it?
For the specimen, yes.
Muller called and Quest removed the charge.
Very, very few people, I think, are catching them. I think a lot of this problem deals with, especially with the elderly who are on Medicare and supplemental insurances. And it's very difficult because if you got Bill A and Bill B concurrently at the same time, it'd be easy to do. But when you get Bill A and then you don't get Bill B till 4 or 5 months later, it's hard for them to remember and to correlate whatever happened at that particular time. I think a lot of people are paying these bills.
Another Fox 8 viewer told us by email, "I'm very unhappy. His biannual trip to the doctor used to cost him $146. That included a blood test. But after his doctor retired, he gave someone else a try. But that leap of faith cost him plenty of money. That $146 biannual visit shot up to $440. As we inspected his bills, the increase resulted from pricier blood work. In the past, his doctor sent him to Quest Diagnostics. The test cost him $27. The new doctor sent him to East Jeff's lab, where the same test cost $284. The viewer told us he's changing his primary care physician.
I'm fed up.
Dave DeBroncart has traveled the world speaking about the rising cost of health care.
There's not a thing I can do to control health costs and be responsible about my spending if I can't see the freaking information.
He says projects like this will help crack the code because patients will be empowered with information to help unmask the secrecy of healthcare costs.
There's nothing magic. There's no rocket science about this. We just need to treat our healthcare billing the same way we treat any other bill in life.
The pages of paperwork health insurers send out can be complex.
There is no excuse for sending us a bill and charging us, even if it's through an insurance company, with things where a knowledgeable person cannot tell whether what you're getting billed for actually happened, much less whether it's a reasonable price. There's no excuse for it.
And DeBroncart says there's no excuse for inflated prices.
I think it's outrageous.
Hundreds of people have already contributed to our database, arming our community with information. Our database reveals who's paying too much.
It's unbelievable.
Like this person in Hammond who went to North Oaks Medical Center for an ultrasound. Humana charged her $865. The same procedure can easily be found at multiple locations for under $200. Experts say sharing information may be the only way to reduce prices.
They charge me $250 just to walk through the door.
By empowering yourself with information and using it to help crack the code on rising healthcare costs.
I looked at the bill and I thought, what are all these charges? That 5 minutes costs another $60 for walking on a treadmill.
A few of the providers and insurance companies we talked to tonight were not able to give specifics, or talked about tonight. We're not able to give specifics about the points we raised in our stories. To see what they were able to say, head to fox8live.com. You can also view a new story right now on NOLA.com. We also want your information. Please contribute your prices, your stories to our database. Do it at fox8live.com/health. Email us at health@fox8live.com or call us at 504-483-1558. We want prices you have on any procedure, but get this right now, we definitely are looking for colonoscopy costs. If you've had that, a colonoscopy, please send your prices for that our way. Tomorrow night, some local hospitals don't want to give you answers. They're hiding information, even though you essentially own some of those hospitals. Watch part 2 of Cracking the Code, our joint investigation with NOLA.com, tomorrow night on Fox 8 News at 10.